the project proposal for Group G. We are Nusrat Mohammed and Todd Mills, and we're going to be focused on visualizing diabetes data. Project goals. According to the CDC, 38.4 million people in the United States have or had diabetes. It's about 12% of the population. Although such a large demographic has been diagnosed with diabetes, getting diagnosed, getting access to treatment, and managing or even curing it varies a lot based on age, sex, location, income, etc. Our goal or our task is to visualize some of these disparities and correlate them with these outcomes in diabetes related issues. We plan to build a tool or dashboard that helps policymakers, healthcare providers, or researchers, or even just curious citizens visualize these disparities and focus on problems that need to be addressed. Some example questions that we hope to answer with this project could be: what factors are more likely to result in a diabetes diagnosis? Can we correlate health insurance type with access to treatment? Are we able to find factors that affect the treatment of diabetes or even the curing of it? We've identified a few key goals for the project. We want to review the data, identify key risk factors that are prevalent in multiple data sets, correlate them: biological factors, environmental factors, medication access, age, sex, etc., and view how that affects diagnosis, health outcomes, treatment, prevalence of the disease. We want to take this and build an interactive dashboard with it so we can show these disparities in treatment rates, complications, hospital visits by location, diagnosis, and other factors. This project will provide a dashboard that aggregates information across multiple data sets and databases to provide a comprehensive overview for public health insights, showing which populations are most vulnerable to these complications with diabetes, and we can showcase factors correlated to an increase or decrease in diabetes diagnosis. Now let's look at the data. Some example data sets and databases that we've come across during our background literature review: the CDC Diabetes Surveillance System is a comprehensive diabetes database. Race, age, state, breakdowns across multiple different factors. The Behavioral Risk Factor Surveillance System, or BRFSS. This is mostly a self-reported data set, which includes mostly lifestyle data, so we can take a look at what people are doing while they have a diagnosis and correlate that with outcomes. The National Health and Nutrition Examination Survey, or NHANES. This is a more hospital-focused database: clinical health data, glucose levels, BMI, HbA1c levels, insurance, and treatment. The Healthcare Cost and Utilization Project, or HCUP. This is also a more hospital-focused database: hospitalization rates across a population and treatment across it. There's also Kaggle. I would like to rely on it a little less, but it could provide supplemental patient-level data if we aren't able to correlate enough stuff across these other data sets. Some of the key factors we want to look at: demographics, age, race, sex, health indicators, whether they have a diagnosis, what type if possible, BMI, HbA1c, fasting glucose, cholesterol, skin thickness, healthcare access, insurance type, well, if they're insured at all, if they have insurance, how often they visit the doctor, hospitalization rates across the population, are they able to manage or treat their diabetes, and socioeconomic factors: income, education, employment status, etc. One good thing about using these big databases is we're probably not going to have to spend a whole lot of time cleaning or fixing the data. We might have to spend a little bit of time correlating reports across data sets if we want to plot factors or variables that are from different databases against variables in other databases. But I wanted to just throw some additional stuff in here on how we'd handle that if we had to. Normalize the quantitative values, income, BMI, glucose levels, HbA1c, if the measurements are different. They haven't been from what I've seen. And we would just exclude records that are incomplete. Now for the visualization. Some example visualizations and things we could plot in this dashboard. We can use heat maps to correlate quantitative and qualitative data, diabetes prevalence by state and zip code, income and insurance coverage, bar and line charts to compare diabetes hospitalization rates across different income groups, or show changes over time in diabetes prevalence or treatment. Scatter plots or even regression plots. We don't plan on doing a lot of prediction, but it's an option. We can correlate two quantitative values, income, HbA1c, glucose. Two key boxes, whisker plots for showing deviation and variance in demographic populations, or even show multiples of those in side-by-side comparison. So for the tools, we want to use Tableau. It's really user-friendly. I've used it before, and it looks really clean. It's got built-in hosting. Filtering is built right into it. Works right out of the box. And students get free 1-year plans. Now, Tableau is a little too easy, a little too simple. We can also use Dash by Plotly. It's Python-based. It's pretty flexible, but it's Python-based. We'd have to do coding for the whole thing. And hosting is not built directly into it. So it'd be a little bit more difficult to showcase a working visualization. Power BI, really clean, really popular, really expensive. Bokeh is similar to Dash. It's Python-based. It's a little bit Web 1.0, though. It's not as clean, not as user-friendly. Timeline for our project. We're going to start off with data collection and processing it. Source the data sets from the databases shown. See if we can find any additional ones. I think we've got a pretty good coverage, though. Clean them up. Shouldn't take too long. Merge them if we're able to. I don't predict that we'll be able to merge a lot of this. There's probably a lot of records that are populated in multiple databases, but we'll take a look at it and see if we can correlate anything across multiple data sets. Initial visualization and prototyping. Take a look at the data, figure out what we need to showcase, what factors are correlated with an increase in diabetes diagnosis, an increase with diabetes-related complications, build visualizations for those, and prototype this design in Figma or Canva before exporting it and building it in Tableau, which would be the next step, developing the dashboard and implementing interactivity into it. Build it in Tableau, test the deployment, test filters, make sure it showcases factors relevant to the project. We'll continue to work on refining the visualizations up to the final report and video walkthrough for the dashboard. As of right now, our next steps are to finalize the dataset selection, clean and collate this data, check out the disparities we want to highlight, and start prototyping our dashboard. Thank you. This has been Group G.
Okay, well, thank you. One quick thing I noticed right at the end, and if this thing doesn't go away, there is no report for this project. It's going to be a video, and I don't want a text report. It's not required, but the video will kind of show how you perform the task that you're saying you're doing it, and how a user will use it, and we look at the data and kind of you demonstrate all of that. So it's a little bit more like a demonstration of your tool that will be done here at the end. So don't worry about report. You also mentioned a little bit about UI. There can be some UI factors in there, but as I told a team earlier, the UI doesn't need to stand in the way of the visualization. So make sure it's not 100 questions we have to answer and then we see a visualization. I don't know if that's something you were thinking or not, but that would be something to consider. So show everything. The interface should just allow us to navigate through that data, to look at the data in a different view, to look at different parts of the data and so forth, different linkages between the data. I don't want to say correlations necessarily, but so that would be more of a user interface thing. On the problem statement, I know it feels like you're halfway through, or maybe more than halfway through, kind of having a precise represent in English what you're doing for this project. But the factors, kind of how are the factors related to insurance? How is insurance return related to the variables? So I don't know, maybe the factors are the variables. You kind of have to glue them a little bit and figure out why would I need to look at all three of them. You can cut it down to two, really, if there's a lot of complexity between them, between relationships between all of these factors and health insurance types and variables. But again, many times the way I think of variables are factors. So keep that in mind. Other than that, it looks good. Kind of keep on going. Power BI, I'm pretty sure it works on a portal last time I checked. So if you mentioned it's behind a paywall, if you need Power BI, I think it's already installed in a portal virtual lab on Blackboard. On the left side, you'll see a link there if you want to use it. And that's pretty much all I have for this